Good morning. We're going to start the next portion of the symposium or the talk. We have now the patient panel with focus on treatment options. And we have the honor and the privilege of being accompanied by a few of our patients. I'm going to present Mr. Jesus Fabian. He's 57 years old, happily married with 3 lovely sons. He was born in Peru and has resided in Florida since 1990. He presently works as a marine services engineer at ABB Inc., providing power generation and distribution services in the cruise industry. He has traveled all over the world for work. After surviving electrocution and beating stomach cancer, his long-awaited achievement is to inspire his children and family that life never ends until your mind is wholly defeated. His ultimate goal is to see his lovely sons happily achieve their dreams and goals. Also, his beloved wife and him have reached their destination full of health and blessing. Welcome, Jesus, if you would like to speak some words.
Thank you, Dr. Antonio Ucar. And yes, unfortunately, I went through all this stomach cancer after, 3 years ago. One day I was doing service maintenance on one of the cruise ships in Caribbean island. That boat journey was not good for me. I didn't feel very well. I have tremendous stomach upset, and I have all this uncomfortable. I couldn't eat. There was no pain. But it was like a stomach upset, and it was like something I ate, and it got stuck in my throat. It couldn't go through anymore. So I finished the project, but only drinking water, and I went to the shop, cruise shop, and I found this milk, protein milk. So drinking those things, I finished my project. So during that time, I called my wife. I mentioned about my stomach upset, and I asked her to go for ask for appointment so I can check up my stomach upset. But I was thinking maybe this was part of my previous accident. I didn't pay attention too much. I say, well, this is probably one of my previous accidents. I'm still healing because like a year and a half back in 2017 December, I was electrocuted, and I end up in coma. I was in coma for about 3 days. Then when I wake up, I find out like I couldn't move my leg, my right leg, and then I see a burn in my hand. It was a very difficult moment when I woke up from that accident. So I went through all these difficult moments, and then with a lot of therapy and with a lot of support, medical support, family support, I was able to recover the strength of my leg. I healed my hand, my arm. So it was a big challenge to go through to this terrible accident. But I was able to recover my strength and my leg and my hand and everything. Thanks to my company, I went back to same job, same duty. So when I was doing this service, when I feel this stomach issue, I thought it was part of this accident. Yeah, when I then after that, when I arrived, when I came back home, I went to my wife already had an appointment with one of my doctor nearby, Dr. Sandra Rodriguez, digestic specialist. So then I went there and I have an appointment with her, and she told me like, yeah, let's do your endoscopy and colonoscopy. So then I have an appointment to do that. When I went back, I did all this colonoscopy and when I wake up, of course I was studied to do this procedure. So when I wake up, the doctor called my wife and myself. And then the doctor said, it doesn't look good. We found a mass about 3 to 4 centimeters in your upper stomach. So I say, well, she said, we took a biopsy. We're gonna send it to lab, and then we will get back to you. All right. So we finish. We get out. I was not worried. I think I say no, it cannot be cancer because none of my family go through this cancer sickness. I have no family history in that. So then next day I was normal. I didn't pay attention. Like it's not gonna be nothing bad. So next day I went to work. I was working around 3 o'clock and I have a phone call from my doctor, and she told me, Jesus, I want you to come to my office so I can give you the results from the lab. And say, I told her, why you cannot, why you just tell me by phone? I'm okay. I can handle it. So then she told me, like, the result came up with the adenocarcinoma cancer. Was not really shocked. It was shocked, but I was not devastated. So after I finished talking to her, she explained to me, and after I finished talking with her, I called my wife. I mentioned about this conversation with the doctor, and then my wife told me, "Please come home." So I packed my stuff, everything. So then I drove home. So when I got home, my wife was waiting for me. She started already crying. For the bad news. Well, after that, we have this talk.
I told my wife, well, this is another challenge. We have to keep going. Let's start, let's start over again. Let's do it. So then my doctor from the Justice Center, she recommended me to go to an oncology. So we went there. They did all this PET scan, CT scan, and some lab works. And then the doctor already scheduled for my surgery. On the way back from the hospital, my wife told me, why we don't go for a second opinion? And then I kind of like say, well, I kind of like reluctance. I don't want to change my destiny, like, but yeah, I accept it. My wife say, okay, my cousin told me to go for the second opinion, please, let's do it. So I accepted to do it, to go for the second opinion. Then we got home, and then we will start looking for different other places. And then we found out this newly hospital for cancer, which is Miami Cancer Institute. Then my wife make an appointment with Dr. Ucar. So and then we went to the first appointment. It was I feel like I was going the right place. Very nice hospital, very nice place. I remember when I was walking through the hall, and you would see like everything is like a peaceful, and there's some music coming. I have like a music coming from the first floor. So I keep walking, and then I look down, I see a gentleman playing a beautiful piano music, very relaxed. I feel special. Walking into that place. Then I wait for my doctor to call me. I went there and I meet my doctor. I think I was stepping in the right place to do my treatment. So the doctor Ucar took my case. He started treating me, doing all this pre-treatment, and he explained to me how it's gonna take for my cancer treatment. So I canceled my other doctor. So I stick with the Miami Cancer Institute. Then Dr. Ucar and his team start doing all this program for me to go through my cancer treatment. First thing what he did a lot of study. Pre-treatment for H. pylori, for a lot of scans and biopsy. He really prepared everything before the chemotherapy. The chemotherapy. Then after all the pre-treatment, all the study, I start my chemotherapy, chemo infusion. That was in August. I was 12, the first chemo. The first round, it was like nothing. I say, well, this is nothing. I mean, I feel good. I didn't feel any side effects. Well, I wish, you know, I think it's gonna be everything like this. I'm strong enough to support all this chemo treatment, because I heard like, no, it's awful, it's terrible. But the second one, I start feeling it. The third one, yes, it knocked me down. It was hard. The fourth one, it was awful. It was awful. But I never stopped. I did not stop the work. The only time when I knocked me down was the second and third day, maybe the second day, because when they did the infusion, I couldn't sleep for 2 days, I think. And then on the third day, I knocked down. I sleep. But on the fourth day, I was already standing doing something. I was this wonderful opportunity from my job. They never stopped me. So I always go to the office and keep working and talking with my friends. And even though I have this the pump, you know, doing the infusion for 24 hours, I go to the office because I know that day I'm still okay. But I know after this, the third day, I'm gonna knock down. I'm gonna go down. It was very, very rough treatment, but I went through. I lost all of my hair. I was completely bald. It was I don't know if you can feel like cold, hot. It messed up your immune system. But at all the time, my doctors and nurses was right there. For anything I have, I feel it. I just have to call them. They prescribe a medicine for anything, for constipation, for not to sleep. But it was okay. I was good. I was positive all the time. I never give up. And then also, I didn't want to hear any news or any thing with the cancer. I just keep going and then and not to hear any negative thing. You just trust in my doctor and my medical team. I didn't do any other things like trusting them. After that, after my fourth chemo, I went to the surgery. So I met my Dr. Ramon Jimenez, excellent person, a wonderful human, as a doctor, as a human. When you met him, it's like you know him for years. I really like him, and as a doctor, and very positive. And in October 28th, I went for surgery with him. He did a subtotal gastrectomy. It was a rough moment also, but after I woke up, I feel like I was thirsty. I asked for water, and then the nurse in the recovery room told me, no, you cannot drink water. Just give me like ice cube. But at that moment, I feel like, man, I made it. I did it. Very good. I have to say, thank you. Thank you for the wonderful job you have done at me. You give me a little bit longer to live. To enjoy the life. Right now, I'm the inspiration for my family. All my family in Peru, my wife, friends. They pray for me every day. And I have to say thank you to those friends for my wife and my family, my sister, everybody plays tremendous support while you're going through this place. And special, I have to say thank you, Dr. Antonio Ucar, Dr. Ramon Jimenez, and all your teams, all your medical staff, Miami Cancer Institute. Excellent, excellent treatment, excellent. I have no words to say thank you. After my surgery, it was quite a challenge, you know. Now it's what to eat. It was we had to learn, you know. We had to re-engineering our system. I have my system. The dietitian from the hospital, they give my wife a training for what to eat, how to cook. And after I was discharged from the hospital, my wife's diet, it came up to play and give me excellent results. She was very careful in what I eat, what kind of food. She was really searching for everything, and all the special food with a highly protein. At the beginning, it was of course small portion, small tiny portion. But little by little, I was adding the portion. After a month and a half, I already started eating solid food. Now I'm on my third year. I can eat. I eat normal. I have no problem. I can eat a regular portion. The only thing is a few things like you cannot eat. Your body will tell you what is good for your body. It will reject if you eat something bad. For example, for meat, red meat, I don't eat that much red meat because I eat, my digestion is slow, so it get me into the constipation, and so I have the red meat. Maybe in one of the blue months, I eat a small piece just to taste. But then after that, everything is back to normal. Back to normal. I'm working as I'm doing the same thing like as 15 years ago. Same duty. I never quit. I'm still doing working the power distribution. So I still traveling all over the world, and I'm doing all my activities normal. I run, I play. I do my regular exercise, but everything excellent. But I have to, on behalf of my whole entire family, my wife, my kids, my sisters and brothers, I have to say thank you. Thank you, Dr. Jimenez. Thank you, Dr. Ucar. Thank you, Miami Cancer Institute. Excellent, excellent treatment. Thank you for all. I really appreciate for all you guys done for me, all the support. Thank you.
So it's been great taking care of you, Jesus. It's our pleasure to be able to help people like you. And thank you very much for sharing your very inspirational story from every point of view. So we're going to move to our next panelist. Jesus, please stay around. We're going to have some questions in the end. Our next panelist is Alicia Gonzalez. She's 70 years old. She was born in Havana, Cuba, and raised in the United States. She came to the United States when she was 2 years old and has lived here all her life. Her parents came to the United States long before the revolution started. Her mother was born in Cuba and her father was born in Key West. Alicia is widowed with 2 grown children, and she has 2 granddaughters. She was diagnosed with gastric cancer 2.5 years ago, and she has been in remission after the completion of her treatment. Thank you very much, Alicia. If you can speak some words.
I have to agree with Mr. Fabian because I am so grateful to MCI and grateful to you and to Dr. Osborne, which was my surgeon, for saving my life, really. My story is a little bit different than Mr. Fabian because when I was before I even knew that I had anything wrong with me, I did have gastric stomach upset, and I had my gastroenterologist, which at the time was Dr. Gubens, and he had done an endoscopy and he had checked for H. pylori because I had had H. pylori in my early 40s, and I got treated for it, and after that I always got checked for it, but I didn't have it at the time I was diagnosed with cancer. And what happened was in February of 2020, in the middle of the night, I got up to go to the restroom. Apparently I fainted, hit my head. And when I hit my head, I cracked the back of my skull. And my granddaughter was the one that found me in the bathroom, called the ambulance, and they took me to the hospital. At the hospital, they sutured. The first thing they dealt with in the emergency room was to suture my skull. But right after the doctor sutured my skull in the ER, I felt nauseated, and I asked for a basin because I wanted to vomit, but what I vomited was huge clots of blood. At that point, they took me to have an endoscopy, and then they found the bleeding ulcer. I was discharged a couple of days later, and then that was March of 2020. The COVID came, and everything was stopped. All the elective surgeries, elective procedures, everything was just on standby. So in the meantime, since my hemoglobin had gone down to 8 from 13, the gastroenterologist ordered these I forgot the name of the medicine, but it was given through the IV for iron to increase my iron levels. So those two procedures for the iron infusions were done, but I didn't have another endoscopy follow-up as the hospital has suggested until June of 2020. In June of 2020 is when Dr. Gubbins called me, and I'll never forget that day. He told me that the endoscopy had shown that I had cancer in the stomach lining. Shock was not the word. I remember getting this cold feeling from head to toe, completely. But he said, we're going to take care of you, and I just need to know, where do you want to be treated? Do you want to go to UM? Would you like to go to Baptist? I said, no, I would rather go to Baptist. And he recommended Dr. Ucar, and he mentioned the surgeon, Dr. Osborne, and that's how I fell in their hands. I started with Dr. Ucar. He put me on the FLOT therapy for chemotherapy. And he gave me all the indications that I was going to lose my hair, how I was going to be. And it was rough. I cannot tell you, but it was rough. And by December of that year, 2020, Dr. Osborne, after I finished my chemotherapy, did the laparoscopic surgery. And the surgery was, I have to say, I don't remember pain. I don't remember any discomfort in the hospital. It wasn't until I got home, dealing with the nutrition, even drinking sips of water. It was like the sips of water was just like going down through my body. I don't even know how to explain it. I mean, that's my issue started once I got home. And then it was like drinking, I couldn't drink any I couldn't have any solids. It was all liquids and soft foods. And that issue remained with me, though the nutrition, I spoke to the nutritionist at the hospital, and she helped me quite a bit, but still I wasn't getting enough calories, and I lost a lot of weight. And also then the chemotherapy that I had after surgery also made me, I had a lot of issues with that also. And as nausea, even though Dr. Ucar gave me medications to prevent all of that, I had a lot of issues with my bowels, issues with just the overall sick feeling. And I even asked Dr. Ucar to not have that last chemo after surgery treatment, and he let me get away with it because he knew how awful I felt. With time, little by little, I started eating. I couldn't eat rice. I definitely couldn't eat meat, like the pieces of meat or even chicken or anything. So what I did was I made homemade soups, and I made homemade bean soups, which gave me the protein and the vitamins, the iron, all the B12, all those things that your stomach doesn't produce anymore. And it's still a struggle. It's still a struggle till this very moment, but I'm much better now. It'll be 2 years post-op in December for my surgery. And thank God that I look back and you think you're not going to recover, but eventually you do. Eventually with time you do. but at the time you don't think that that's going to happen. I am very grateful for Dr. Ucar and Dr. Asper for the surgery, because the surgery went very well and my treatments have gone well, and I feel like I am blessed. I am really blessed. I am blessed that I can eat better now, not normal, but I can eat better now. I just eat more often. I do get hungry. I do get hungry. For some reason, crispy, I can eat the crispy bread. I don't eat bread that's not toasted. I don't eat that. I eat anything crispy, anything toasted. And in the beginning, I ate a lot of yogurts also. I had a lot of dairy and a lot of homemade soups and homemade meals. And I think that helped me quite a bit. And now I can eat a little bit. Now I eat better. I have to say I eat better. Just not everything at once. No. Oh, those days are over for me. I eat small portions here and there, and of course, since I eat small portions, I eat more often. Yes. Sometimes my sugar levels go down because I didn't have enough protein, but other than that, I'm getting by. I am very grateful to Miami Cancer Institute. I mean, I actually enjoy going there. And like Mr. Fabian, yes, the music and the staff, they're all excellent. And his office staff is excellent. And his nurse practitioner that works with Dr. Ucar, she's also excellent. And I am very grateful for Dr. Ucar because he has maintained me in my upcoming health. I have to thank him and thank Dr. Asborn as well, and thank the whole staff at MCI.
Thank you very much for sharing your experience, Alicia. Believe me, we're aware that you went through a lot. I mean, we lived that with you, and it is also difficult for us. I mean, not to the same extent. I realize that for the patient, it must be 1,000 times worse, but we sympathize with the circumstances you're going through, and that we obviously try to help as much as we can. We know that treatment can be difficult, but when the reward, it's the type of reward that you're achieving, getting cured and living a long life, I mean, then we understand why we go through all this. Thank you for sharing your experience again. We're going to move to the next panelist, Jose Carlos, better known as JC or Jose C, is a 39-year-old who was diagnosed with gastric cancer in December 2021. He was scared, obviously, with the diagnosis initially, but after he was educated on the stage of gastric cancer and his diagnosis, he realized that he had an early stage that was curable. Dr. Jimenez and myself explained in detail about the course of treatment, and after getting chemotherapy, he had surgery by Dr. Jimenez, followed by some additional chemotherapy. We tried to convey confidence and peace of mind to him. Then, without more to say, we're going to ask JC to share his experience. Jose?
Hey, hi. Just want to make sure my microphone is working. Can you hear me?
Yes, it is. We can hear you well.
Good. Okay. So, hi, Dr. Ucar, the panelists, Dr. Jimenez as well. So, yes, I was diagnosed in December 2021. Initially, I went to gastric health, like behind the Baptist. So I just went for a routine because I noticed that my stool were getting, I was getting like this dark color. So I just went for just a routine. I wanted to make sure what was it. Yeah, I did have a excessive gas, you could say that. And Dr. Enriquez and suggested to just have an endoscopy, which I agreed to it, even though the insurance didn't want to pay for it because of my age. But we just pushed it, and I was able to get it, even though I had to pay a high deductible for that, but it was worth it, of course. So I got the endoscopy, and I thought that was just an ulcer. So they found an ulcer, 8 millimeters, and I just thought that was it, right? That it was just gonna go away. Even the I forgot the doctor, the one that she performed the endoscopy. She said, "Oh, you just have an ulcer. It's fine. I'll send you some medicine. I think it was ultra fat. What's it called? Sucralfate, right?" So she sent me that medicine, and then she just said, "Oh, you'll be fine with that. It will get cured. It's just an ulcer, but we're still gonna do a biopsy on it." So I was already planning my trip to go, because I have my wife in South America, so I was just already planning my trip there in December, to spend Christmas, New Year's, Carnival. I was gonna stay for 5 months down there, and just totally forgot about that I had an endoscopy and they were doing a biopsy. I was just, I'm not getting a call. That's fine. I never thought that I was gonna get that call when it was like at 2:00 and on a Friday. I remember that. And the doctor called, and I was just expecting to hear, "Hey, we just got the everything's fine. Take your medicine and you're good." I thought that she was just gonna say that, and just having a casual conversation with her. And then she just dropped the bomb. She said, "Well, we did the biopsy, and we found that that you have cancer." And I was like, that feeling like your world, like, and everything stops, because I never dealt with this, and I never had a case of in the family, like from my father's side, my mom's side, never had a case like dealing with cancer. I mean, I of course I seen stories, and but I wasn't educated about the cancer, what the stages are, or anything about it. I just heard the word cancer. You are diagnosed with cancer, and we're still gonna do a second biopsy, but so far it all indicates that it's cancer. And it was like Friday, 3:00. It took me about, like, I would say, a couple of days to digest those, because it was the weekend, which was even worse, right? Like, because you want to get information, you still want to talk to the doctor, want to get more information about, like, what is it, right? Like, and it was Friday, I remember, and I had to, like, deal with it for the weekend. On Saturday and Sunday, cancel all my plans. I called my wife, and also, she was crying, and I was like, okay, let's just calm down and let's wait to Monday so we can actually have a conversation. I will go in person to Gastro Health and just get information about it. Like, what is it? Because, I mean, her name was Dr. Alicia Guzman, I think. to the doctor. So anyways, so just to make the story short, I went on I went on Monday. I just showed up there. I walked in, and I mean, she was, she was receptive. Oh yes, and she said, oh yeah, we found this. We're gonna refer you to the surgeon, which is Dr. Enriquez, and gastric and gastro health. So, but she didn't have much information about it. She didn't want to just discuss. She just said, this is cancer. Most likely, we're going to refer you to the surgeon here, Gastro Health, and probably we'll send you to Baptist MCI. So if they see that you might need treatment, chemotherapy, you might have to do that. I was like, when I heard chemotherapy, I was like, wow, this is really happening, right? Like, this is happening. I have cancer, right? But as soon as I scheduled the appointment with Dr. Enriquez, the surgeon for Gastro Health, he was very honest about it. He said, he told me that it would be better for me to get the surgery at the MCI with because he didn't have much because the location of the ulcer was in the cardia between the esophagus and the stomach. So he wasn't 110% sure to perform that surgery, and he was honest. And he just said, we have these professionals at MCI, Dr. Ucar and Dr. Jimenez, and I think they'll be more capable to proceed with this. You'll be in better hands with them. And he was honest, and I appreciate that. Actually, he took the time to actually refer me to Dr. Ucar, because I know Dr. Ucar is pretty booked when you try to call him like in person. But Dr. Enriquez from Gastro, he actually, he squeezed me in with Dr. Ucar. And when I got the call from Dr. Ucar's staff, like immediately, like after 2 days, and I know it was January, like, they go on vacation, and I was seen right away, about a week, and I appreciate that so much, doctor. So I was, so finally, when I met with Dr. Ucar, I would say after a month of my diagnosis, because, that takes time to get all the diagnosis, like re-diagnose it again. So to be honest, I felt so relieved, and I had this peace of mind, because not only I was so nervous and so scared for that appointment, like to go see Dr. Ucar, because I never thought that I was gonna deal with an oncologist in my life, ever. But yes, I went to see Dr. Ucar, and I thought I was just gonna cry that day after, because, like you just wanna hear cancer, what he's gonna say to me, because I didn't know it was curable, terrible. I mean, Dr. Enriquez told me something about it, but he said that Dr. Ucar was gonna give me more information about it. So, but I was still scared, right? Because maybe he's gonna say that I have a few months to live, I'm gonna die soon. Those were my thoughts when I walked into an oncologist's office, which is Dr. Ucar. But after he educated me, I will say the appointment lasted about 30 minutes, 45 minutes, but it was just educational, like all about what the cancer is all about, what the stages are, what's the treatment that we're gonna pursue. And he educated me on that, and I felt like this peace of mind. Even my wife was so relieved. She said, "Oh my God," because not only that he educated me, but he was very optimistic, and she said, like, this is treatable, this is curable. We found it on time. It's not progressing, but still we gotta do all these exams and the PET scan and all that. And he just, he guided me through it. He said we're gonna do correct me if I'm pronouncing it wrongly, conjunctive therapy or something like that. So we're gonna do 4 chemotherapies, and we're gonna go very aggressive on your case because you can tolerate it because of my age. So he said it. We're gonna go very aggressive. We're gonna mix 3 chemos, three medicines, and we're gonna give you 4 treatments, and then we're gonna do the surgery. Dr. Jimenez is gonna do the surgery. He referred me to Dr. Jimenez, and that's another story too. And then after the surgery, we're gonna proceed with the other 4 chemotherapies to just clean it up, make sure that it's being done correctly. So I was like, sign me up, let's do it. I never thought, I heard that chemotherapy could be really tough on patients, because you lose hair, you're completely weak, your immune system. So once we started the treatment on the chemotherapy with, we used oxaliplatin, Taxotere, and then there was another one that I had to take home on the little pump. I forgot the name of that, doctor. It's a little complicated. I just remember the Taxotere and the oxaliplatin, especially the oxaliplatin, which is the hardest one. So we did the 4 chemotherapies. I would say the first chemo was okay. I did have the symptoms, the side effects, but I was able to tolerate the first part of the treatment, which is like the four chemos before the surgery. I lost my hair, right? Like my eyebrows, eyelashes, completely, but it's worth it. That's minimal. That's nothing compared to what it was. So we finished that, and then also I met with Dr. Jimenez and his staff. Dr. Jimenez, I love him. He's awesome. He educated me also on the what we're gonna do on the surgery and what are the possibilities of the surgery, because they were gonna do a biopsy while I was on the surgery, and they were gonna check if the other areas of the stomach were also affected, and if they were gonna find any cells that had cancer in other areas of the stomach, we will have to remove the entire stomach, so do a full gastrectomy. And when I heard that, I was just praying that not be the case. I really, because I really still, because that's a life-changing situation, an entire gastrectomy. But you kind of make the peace with it. You try to adjust to it, but you're still hoping that that's not the case. So when we went to the surgery, thank God it was just that area that was compromised. So still I got 30-35% of my stomach removed. We kept the rest, and of course, the surgery took about, correct me if I'm wrong, about 10 hours or 11 hours. We couldn't, because originally we were gonna do a with the robotics, the surgery, like non-invasive, minimally invasive. So that was the original plan, but I was so fat, so overweight, I would say, that they couldn't reach my stomach with the with the robotic. So they took about 3 hours trying to actually get a hold of my stomach with robotics, and they couldn't do it. So they had to do an incision, just go old school, remove it, and that's all I remember. And then when I woke up, I was in so much pain, and Dr. Jimenez said, "Oh, we have to actually cut you." That's the only bad news I have. Anything else, you keeping 70% of your stomach, those were good news. And it's just with so much pain, but I was just relieved to hear those news, and that they remove everything, all the that ulcer that I was causing the problem there. I was hospitalized for about 7 days, and I would say probably that was the hardest part of the treatment. Not as much as the chemotherapy, but just being in the hospital, the psychological part. Because you're in a hospital, obviously, they taking care of you, but I couldn't sleep, to be honest with you. I probably had on those 7 days, I probably had combined of the entire time that I was at the hospital, I probably got like 3 or 4 hours of sleep. There were nights that I couldn't sleep at all because, you know, it was not only the pain, it was also the how your body's reacting to the surgery, right? Like the bile that you throwing up. When I was about to pass out and falling asleep, I would get all this gag of saliva and bile on my throat, and I couldn't sleep. And also, you know, like you're with other patients, and you're at 3 a.m. and you hear the alarm calling the nurses. The nurses, like, you know, like taking care of you at 3 a.m., taking your vitals. So, but after that, I was just like, when I got home, you know, I know I had to adjust. It was gonna be a couple of months because I was with the feeding too. I came home with a feeding too, and just I would say, just getting adjusted to my new stomach, right? Like I couldn't eat solids for about a month. Only had to do like shakes, liquids, and even though when I tried to digest a smoothie, and that was after 2 weeks of the post-op, it was hurting so bad. But, you know, again, Dr. Jimenez educated me on that as well, on the what the esophagus looks like inside, you know, the scars that when you digest, and it hurts, of course. So, but yeah, it's getting better with time. I mean, again, this is recent. You know, I got the surgery in May, and I started eating normal about 2-3 weeks ago. But obviously, small portions. I'm not able to eat a whole meal. So I'll say, but which is good. I save money, of course. But I love it, and I'm looking good. I love the fact that I was extra large on my t-shirt, and I'm a 5'8" guy, 5'8". So like for me to be really fat, it doesn't look good, right? I was wearing extra large, so now I wear medium, which is good. I feel with so much energy compared to what it was, and I guess, you know, that's one of the benefits. And you know, like the saying in Spanish, like no hay mal que por bien no venga. Sometimes, you know, you gotta see things like, okay, it could have been bad news, but maybe it was a blessing in disguise, right? And obviously also in the spiritual part, in learning about like, you know, what I want for my life. Because at that time when I got diagnosed and just going through it, even though with chemotherapies too, right? Because you get depressed when you're on chemotherapy, and that affects your serotonin levels a little bit. It makes you realize, you know, that you know, we shouldn't be taking life for granted, right? Like it's a gift. It's a gift, right? And all you can do is just make the best of it, and, you know, be kind to others, treat people well, be kind to animals, and just appreciate life to the fullest, right? Nature, animals. And no, I'm grateful to Dr. Ucar, Dr. Jimenez, the entire staff, Miami Cancer Institute. Seriously, like it was the best, I would say, treatment I ever experienced. You know, just like they don't miss any details, right? Like it's just, you know, they constantly calling you, making sure you go to your appointments, and nothing. It's just I'm thankful, you know, that I, you know, I was in good hands with you guys, and well, also my insurance. They were able to. They didn't give me so many hard times. So, but yeah, I'm very grateful to you guys, Dr. Ucar.
You're welcome, very welcome. I'm glad that things have worked out very well for you. I'm happy for you, and for the change that you're already trying to make in your life. Thank you for sharing your experience. And thank you to all the panelists for participating in this section of the symposium. We're running a little over, so I think that this will conclude this portion of the symposium. Again, thank you very much for sharing your experiences and for devoting your generous time to participate. Thank you. We will have a break and we will meet again at 12:45.
I'm Debbie Zellman. I'm president and founder of Debbie's Dream Foundation. And why am I here, right? I was diagnosed at the age of 40 with stage 4 advanced incurable stomach cancer. I had no risk factors of the disease, no thoughts that I could possibly have stomach cancer. And the 5-year survival when you're diagnosed with stage 4 stomach cancer is only 4%.
I was basically told you have a few weeks to live. So I started my treatment, and thankfully I responded to that treatment. And together with my son, we talked about making a difference for others while I was closing down my law practice and fighting for my life.
I actually founded Debbie's Dream Foundation, Curing Stomach Cancer, to help the so many who don't respond to the chemotherapy that they're given and understand the chemotherapy that I was given was about 30 years old. No advances had been made.
They did an endoscopy, and right at the GI junction of the stomach and the esophagus sat a tumor that had been bleeding and profusely bleeding, and so that was really the symptoms I was having was from blood loss, and my body was essentially shutting down. And so the day before my 33rd birthday, I got the phone call to say that I had cancer.
I was doing pretty good. The blood in my stool was my only symptom, and so I brought my 6-year-old son with me to this appointment. And when I showed up there, he says, I don't have the results yet, I'll give you a call. And I'm just like, okay, no big deal, right? So like he obviously knew. He did this on purpose. He didn't want to tell me in front of my son.
Cancer has taken away the idea of possibly having kids. Because why do I want to bring kids into this world when there's no guarantee that I might not be here for them?
It's more like every day could be your last now, which is a different way I've ever lived. You know, I always thought you'd live to, till you're old. And you can see your kids grow, and that's how life's supposed to be. You have grandkids. And it's not like that anymore.
Cancer robbed me of my wife of 21 years. It robbed my kids of their loving mother. We'll always have a void.
Cancer does not discriminate. It doesn't care how old you are or your education level. It doesn't care about your financial status or what job you have. It doesn't care how smart you are or if you have young children or loved ones who depend on you. It just invades your body, and it will do whatever it takes to survive.
It takes a tenacity in people from Debbie's Dream Foundation and other foundations of other cancers to bring that awareness.
To say that we need more awareness, we need more research. We have our vets overseas right now that are fighting for our country, coming back with H. pylori that turns into stomach cancer, and we don't even have awareness for them.
So our mission is to raise awareness, to fund research, to advocate for more research funding, and to educate and support patients, families, and caregivers internationally.
Debbie's Dream Foundation is the most effective advocacy group for gastric cancer in the country. Its website is rich in detail. It's a place for all stomach cancer patients, whether they're just diagnosed or fighting the disease, should go for information and resources.
I think in the next decade, there has to be more attention to rare rarer cancers. Stomach cancer, I think, is number 2 from the bottom of the list as far as available funding for research. And that's crazy.
Hi everyone, it's Zach. For those who don't know me, I'm the son of Debbie, the founder of Debbie's Dream Foundation. I'd just like to thank everyone for your continued support of Debbie's Dream Foundation. I'd also like to stress the importance of keeping up our efforts in the battle to cure stomach cancer. It's crucial that we keep the fight going and press harder than ever, because that's what my mom would have wanted us to do. Thank you all for donating your time, energy, and resources towards this amazing cause, and let's keep fighting.
Thank you so much for your support. It helps us continue the fight and to achieve the dream of someday curing stomach cancer.